Question number 1.
In the image provided, label the urinary system according to its basic parts and its function. Number 1. Kidney is the organ that filter blood and remove wastes, fluids, and electrolytes. Number 2. Ureter is a tube that carries urine from the kidney to the urinary bladder. Number 3. Urinary bladder is a hollow organ that serves to collect urine to be voided through urination after the urine is filtered through the kidneys. Number 4. Urethra. Its main responsibility is to let urine pass from the bladder out of the body.
Question number 2.
Nurse Mimi is providing education to group of students. She doesn't need further teaching if she says that the following are major functions of the kidneys, except A. Vitamin D synthesis, B. Erythropoiesis regulation, C. Maintenance of blood glucose levels, D. Regulation of blood volume and pressure. Let's apply the process of elimination. The kidneys convert vitamin D from supplements or from the sun to the active form of vitamin D that is needed by the body to maintain bone health, making option A a correct statement. Erythropoiesis is the process of producing red blood cells. It is stimulated by decreased oxygen in circulation, which is detected and processed by the kidneys, making option B a correct statement. Maintenance of blood glucose levels happens by the regulation of insulin and glucagon that happens in the pancreas and not in the kidneys, making option C an incorrect statement. Kidneys play a crucial role in regulating the body's level of sodium, potassium, and remove excess water from the body that helps regulate blood pressure, making option D a correct statement. Therefore, the correct answer is letter C.
Question number 3.
One of the students asked Nurse Mimi that, since vitamin D is synthesized in the kidneys, it is then converted into an active form known as blank. A. Glycogen, B. Creatinine, C. Calcitriol, D. Calcium. The correct answer is letter C. Calcitriol. Calcitriol is also called 1,25-dihydroxy vitamin D3. It is the hormonally active metabolite of vitamin D which increases the level of calcium uptake from the gut into the blood. Glycogen is a substance deposited in bodily tissues as a store glucose polymer that is used as an energy reserve. Creatinine is a waste product in your blood that comes from normal muscle wear and tear. Calcium is a mineral that helps in maintaining healthy bones and is not an active form of vitamin D.
Question number 4.
Identify the parts of the kidney based on the arrow it indicates. Number 1. It is the inner part of the kidney that helps in regulating the concentration of urine by filtering out water, salts, and acid. Renal medulla. Number 2. This section of the kidney appears as a large chamber. It is funnel-shaped in appearance that aids in draining urine to the ureter. Major calyx. Number 3 is a small cup-like structure that collects urine from the papillary ducts. Minor calyx. Number 4. It is the entry and exit site for structures servicing the kidneys such as vessels, nerves, lymphatics, and ureters. Renal hilum. Number 5. These are the spaces between the renal pyramids and the renal papillae. Renal column. Number 6. It is a small tube or duct that connects the bladder and kidneys. Ureter. Number 7. It is the thin membranous sheath that covers the outer surface of each kidney. Renal capsule. Number 8. It provides space for arterioles and venules from the renal artery and vein to allow blood circulation on the nephrons of the kidney. Renal cortex. Number 9 are kidney tissues that are shaped like cones that maintains proper balance of salt and water in the blood. Renal pyramid. Number 10 are areas where the openings of the collecting ducts enter the kidney and where urine flows into the ureters. Renal papillae. Number 11. It collects urine and transports it to the pelvis through ureters. It is where reabsorption of excess water also takes place. Collecting duct. Number 12. It is the functional unit of the kidney, the structure that actually produces urine in the process of removing waste and excess substances from the blood. The nephron.
Question number 5.
To gauge the student's comprehension, Nurse Mimi poses the following question. Approximately how many liters of filtrate enters the nephrons each day? The students are correct if they answer A. 80 liters. B. 180 liters. C. 250 liters. D. 350 liters. The correct answer is letter B, 180 liters. The normal glomerular filtration rate amounts to about 180 liters or 45 gallons every 24 hours. This is 4.5 times the amount of fluid in the entire body. The renal tubules reabsorb around 99% of the filtrate, leaving only 1.5 liters to be excreted as urine during a 24-hour period.
Question number 6.
Nurse Mimi is reviewing a client's fluid intake and output record. As part of the principle of fluid intake and urine output, the students are correct if they say that A. Fluid intake should be double the urine output. B. Fluid intake should be approximately equal to the urine output. C. Fluid intake should be half the urine output. D. Fluid intake should be inversely proportional to the urine output. The correct answer is letter B. Fluid intake should be approximately equal to the urine output. Normally, fluid intake is approximately equal to the urine output, but still other factors such as humidity and physical activities are to be considered, as sweating can be counted as part of fluid output. Fluid intake that is greater than the urine output indicates fluid retention. Fluid intake that is half the urine output indicates dehydration or other medical condition, such as polyuria.
Question number 7.
Antidiuretic hormone, ADH, secreted by the posterior pituitary gland, passes through the circulatory system to the kidneys. ADH regulates the amount of water reabsorbed by the distal tubules and collecting ducts. What happens to the distal tubules and collecting ducts when ADH levels increases? A. Increase permeability. B. Decrease permeability. C. No changes in permeability. D. Secretes more erythropoietin. The correct answer is letter A, increases permeability. In the process of blood filtration in the kidney, filtrate passes through the distal tubules and collecting ducts to be excreted as urine. With the presence of antidiuretic hormone, the permeability of these ducts increases, allowing more water to escape from the filtrate and less urine output is produced. These escaped water is then bring back to blood circulation, preventing dehydration and water loss.
How many correct answers did you get? I know you got it all correctly, but wait, don't forget to hit on subscribe button and turn on notification bell so that you will be notified for upcoming videos. You can also share this to your friends. Goodbye.